Hi folks, this is Dr. Virender Sodhi, first ayurvedic and naturopathic physician in USA. Allergies, very common, almost everybody has some kind of experience with it, and I have my share of it too because I have allergies, suffer with allergies all my life, and I'm going to tell you what I have done to prevent my allergies and have a minimal allergies symptoms as compared to many other folks who have allergies. So I will tell you some interesting facts about it. If one of your parents has allergies, there are chances of 30 to 50% of you getting allergies. And if two parents have allergies, chances of you getting allergies of 60 to 100%. So it's like a compound. If you have two parents have allergies, you have a lot more allergies going on there. The another thing which is a stress, and I've seen personally too when the stress, when there's a stress in my personal life, my allergies goes crazy. So we should all be doing stress management to help cut down the allergic response. Basically, what happens when you are under stress, you're making a lot of cortisols, and body kind of your immune system is not functioning as properly, and you are breaking down the mast cell which has histamine in, and triggering varieties of inflammatory pathways in the body. So different places will have different kind of trees and grasses and pollen depending upon where you are, and there is a link which we are putting for you down there, and it's called stagarallergymap.com, and you can go on that, and this will be in your description, and you can find out which area you live, and that will tell you what kind of allergens are prominent in that area, and so you should do accordingly. Okay, what you can do for prevention. The first, I will start with the home. The home environment, internal environment should be very, very clean. So what I've seen is, like, if you have carpet in the house, carpet harbor a lot of dust mite. 1 square inch of carpet can have 1 million dust mite. And dust mite, when they're alive, they're not a problem. When they die, their fragments are floating into the air, and now that is a problem. If you have a wood stove, if you have a gas-fired stove or gas-fired heat in the house, there are also big issues there too. So I encourage people to put a specific filters on the heating places or in the room, or standalone air cleaner purifiers in the room. So these are very simple things which you can do. Also, be sure that make your duct line clean. If you don't clean your duct line on a regular basis, you'll be blowing a lot of dust into your atmosphere in the house and creating a lot of problem for there. So these are simple solutions. There are folks who do that professionally. They come in your house and clean your duct and chimney. So get that clean pretty on a regular basis. Okay, so now what you can do to get your allergies better. So one thing is avoid food which will cause more allergies. Sugar is the biggest culprit for almost anything, but also for allergies. And then mucus promoting food like milk, yogurt, butter, ghee, they all promote more mucus in you. Ghee may be on the lesser side, but also wheat, pastas, anything which is more carbohydrate rich and plain and more refined carbohydrate, more mucus producing. So you want to avoid or cut down that drastically. Ayurvedically, we said we use dry grains like corn or barley, which is on the drier side, buckwheat, millets are less mucus producing grains. A lot of beans are good for you. Eating fish is really very healthy for you. Even chicken and animal protein will be okay too. But excess of everything is bad, so be sure that you make sure that you don't indulge too much in anything. Adding lots of fruits and vegetables which has colors in it, and those colors are bioflavonoids. Like beets has that specific color to it, which has a betalain in it, and a betalain has an anti-allergic responses. What it does, it actually helps the mast cell. The mast cell is the white cell which has a lot of histamines in it, and when the mast cell breaks down, the histamine releases and it causes allergic responses on our mucous membrane, and we become more irritated in those mucous membranes and causes sneezing, watery eyes, itchy throat, itchy ear canals. So all those things can be stabilized by not breaking those mast cells. So what you can do to help that process? Local raw honey. Buy local raw honey, because the bee is going to go to 200 different kinds of flower and collect the honey, and that honey will provide you that small amount of that allergen, and it becomes like immunotherapy for you. Immunotherapy is a kind of treatment, by the way. You can also use bee pollen, which has shown also very positive effect. Vitamin D, sunshine gives you free vitamin D, but if you're deficient, make sure that you take around 5,000 in Northwest here. Depending upon your area where you have a lot of sunshine, you may need less, but get your vitamin D level checked and then substitute it accordingly. I don't want you to overdose in it and then create a problem. Also, if you're taking 5,000 like I prescribe in Northwest, get your level checked at least every 6 months or 1 year so that you're not getting over. Vitamin C is occurring in the mother nature. A lot of sour fruits and vegetables has that. So consume those sour fruits and vegetables, which will help you. Amla is another naturally occurring vitamin C in it. You can use that to help prevent allergies. Another compound which you can use is called NAC, which is also very helpful. It thins the mucus and helps to drain it out. Holy basil is a Ayurvedic herb. Guduchi, which is also called Tinospora cardifolia, long pepper, licorice. These combinations are available and they can be very, very effective for you. So we talked about already the fruits and vegetables which you can take to help the process then. And then, the therapy wise, you can use sublingual immunotherapy. So first you need to find out what kind of things you're allergic to. You can do through the blood test or skin pinprick test. The simple method will be done through the blood test. And once you find out what kind of things you're allergic to it, then you order from a special pharmacy. They make that immunotherapy. Those allergens are in a very minute dose, put into like a sublingual drops, and you put under your tongue. It's a long process. It doesn't happen very quickly, but you get better. Maybe in 3 to 5 years, your allergic response reduces. The another thing which we have seen very effective in my clinic, I've used on my personal basis too, which is called autohemotherapy. So basically what that means is you draw your blood, you put in a tube, and then you oxygenate with ozone and then inject back into your body intramuscularly. And so basically we are doing the same thing which with the sublingual immunotherapy. Your blood has all the allergens in a small amount, and now we're injecting back. The body is mounting a response to it and creating the immunotherapy over time. And that can be also given intravenously too. Different people will benefit differently from these kind of therapies. Like some people benefit more with the intramuscular injection of autohemotherapy, some with intravenous. So if you have any questions, you're most welcome to call us or like our channel, subscribe to it. And if you have the allergies and if you follow these and you got good response, please put your comment underneath this link there. Thank you very much.